How can a health professional best support a patient who has been traumatized?
Well, this is addressed to my fellow physicians who are not psychiatrists and not trauma experts, and also to other health professionals, nurses. I'm thinking of those of you out there who are going to have a survivor of something terrible, rape, primarily rape, but other incidents like battering that they're unlikely to want to talk about, and you're the first one that receives this information. And first of all, thanks for listening, because it's the general doctor who receives more of this fresh and firsthand than we ever do in psychiatry. We get referrals. And many of my patients have told me that their general doctors handled them so well, actually did better than the therapist. And often that's because you have a relationship, a pre-existing relationship, and they trust you, and you are an authority. And nowadays we forget what kind of authorities we are with all the paperwork and the hassles, but doctor is still looked to by the patient who's willing to talk to you as someone who's very, very precious. And let's say you are going to hear about a rape, and you're going to be the first person to hear about it. It's, first of all, so important that you, and of course you may already know this, so I'm not preaching to those who are comfortable, but for those who may be somewhat new at this and may feel a little bit awkward, first of all, it's important that the setting be right. Sometimes we work in a way where phone calls are coming in or we're distracted. You start to hear something that's intimate like this. I would advise send a signal to the nurse or the receptionist. No calls. I'm going to need to be uninterrupted for a while. And that gives a signal to the person who's talking that you're listening and you're taking it quite seriously. I think it's important, as always, to be professional, not to show a whole lot of shock or really much in the way of response that goes to causality. A victim often feels responsible for his or her crime. So you don't want to say anything that could be interpreted as blaming them for what happened to them. You may want to know some more of the circumstance, because you may want to help that person avoid a sexually transmitted disease, have evidence collected through a rape trauma kit if that's necessary. So you may want to ask some questions of that nature. You may want to ask also if the person would be more comfortable if anyone else were with them. Often this is a female reporting to a male, and she might feel better with someone there with her. She might not. So you can ask about that. You may pick up signs of traumatic stress and want to refer to a psychiatrist. But if you do that in a way that doesn't imply there's something wrong with you, you're mentally ill, and I want to get you off to the specialist and not hear this story myself. Beyond that, I think the cases are so individual and different that we'd have to have a discussion rather than me give some general tips. And I think this is all common sense. I remember not too long ago teaching the psychiatric residents about trauma. One of them said, one of my patients is a rape victim, and I've never asked her about it. I think it would be embarrassing for her to tell me the details. And I thought, my goodness, that's like a surgeon who doesn't want to cut because it might cause pain. It's important at some point for a survivor of a humiliating and painful and emotionally charged event to have a professional able to receive that story and able to help someone digest it and work with it. Now, that may not be you, the obstetrician, the internist, the general practitioner, but it could be you. And I will certainly tell you that many of my patients have found their conversations with you to be the most meaningful that they've had, and it places them on the path to getting further help. And just a few things further. In the case of battered women, they often end up forgiving, and we can be frustrated with them. Prosecutors certainly are, friends are. Why does this woman stay, and why does she excuse her partner's behavior? There's a lot that we can read about this, and I've written about it, and there are tools available through the Gift from Within website as to why the battered spouse stays. The point is, they're not masochistic. They're not enjoying this. They don't see many other options. It's hard to break that cycle, and we may feel frustrated and even angry that that cycle exists and that it persists. But we've got to be careful not to take that anger out on the survivor. If they're talking about this, they're on the way. They're taking the first step. I don't think a woman who's been bullied wants us to bully them into going to a shelter. We want to make it inviting. We want to show respect. So we really have to contain our frustration if we're frustrated that someone has allowed themselves to be re-victimized. It's not the victim's fault. So, in sum, thanks for listening to this. Your job helps me do my job, and I really respect you for taking the time to listen and to learn.